Dr. Pride, how are you?
Glenn Pride spent years taking care of people as a physician. Now he is the patient, under the care of vascular surgeon Dr. Frank Arco.
It was an ultrasound that found the aneurysm.
How are you doing since you had your procedure?
Dr. Arco repaired Dr. Pride's abdominal aortic aneurysm.
That woke me up a bit because it is oftentimes capable of rupturing, and you have very little time to at least get to an office or get to wherever to be cared for.
Take a big deep breath in.
Abdominal aortic aneurysms grow slowly and have few symptoms to warn of their presence. When they rupture, aneurysms cause severe internal bleeding, and patients need immediate medical attention.
There have certainly been many famous people who have died of ruptured aneurysms, including Albert Einstein, Lucille Ball. So it can be very common, and it can happen to anyone.
An abdominal aortic aneurysm is in the aorta, the body's largest artery which carries blood from the heart. Sometimes the pressure of pumping blood causes a weak part of the aorta to bulge. Patients can experience a pulsing sensation in the abdomen, severe unexplained pain in the lower back, or on rare occasions, pain or discoloration in the feet when material from the aneurysm sheds and moves.
Most often it's smaller pieces that travel down to the foot and result in a blue toe syndrome. So anyone who presents with sort of discoloration of their toes in a workup should be looked at to make sure that they don't have an aneurysm. Dr. Pryor, we're going to take a feel of that aneurysm.
At times, doctors can feel an aneurysm around the belly button during an exam, but most are found, like Dr. Pride's, during tests for other conditions.
The most common way that we have patients referred to us is that they're in the workup of another issue. They undergo a CT scan or an ultrasound, and during that imaging study, they're found to have an aneurysm that's quite large, and then that needs to be repaired.
Most aneurysms are found in patients over 60, and doctors recommend screening at age 65. Men are more likely to develop them than women. Factors that contribute to risk for aneurysms include smoking, high blood pressure, high cholesterol, obesity, atherosclerosis, also referred to as clogged arteries, and family history of aneurysms. Most important, patients with diagnosed aneurysms need to be under the care of a vascular surgeon.
He had to do some convincing that I needed it done now, not 2 or 3 months later. But I was pleasantly surprised when it all turned out well.
Ask your doctor about your risks for vascular disease. Visit vascularweb.org to find a vascular specialist and learn more about vascular wellness.